It's time to start the exercises for runner's knee. Exercise 1. Massaging the outer thighs. You need a Blackroll Fascia Roller for this first exercise. Place the roller on the floor. Lie on your side while supporting yourself with your forearm and position your outer right thigh on the Blackroll. Now push and pull yourself back and forth on the fascia roller using your left leg and arms so that it rolls along the muscles on the outside of your thigh. Be sure to move your position forward so that the outer part of the front thigh muscles is also treated. Make sure you are going at a leisurely pace. Relax your right thigh and take calm breaths. Find a painful spot and apply pressure to it for about 15 seconds. Take deep breaths in and out, which will relax you. Roll your muscle out again briefly. Switch sides. Move the roller to the left side and place it under your thigh. Push yourself forward and back again and roll out the outside of your left thigh. Perform the movement slowly and let your breathing relax you. Work the inside as well by turning your legs slightly inward. Find a painful spot and keep applying pressure to it for about 15 seconds. You're almost done. Roll one more time from front to back at a relaxed pace. Slowly come out of the position. Exercise 2. Massaging the hip flexors. You need a Blackroll Ball 12 for this next exercise. Lie down on your stomach. Place the ball above your groin between the top of your right hip bone and your straight abdominal muscles. Support yourself loosely with your arms. Let yourself sink down slowly onto the ball. With each breath, you should sink a little deeper into the ball. Relax for about a minute. Be careful when doing this exercise. If you feel any throbbing in your abdomen, you should switch positions. Concentrate on breathing from your abdomen. Time to switch sides. Work on the other hip flexor by placing the ball on the other side. Let yourself sink down onto the ball again. You can get even deeper into the tissue through your breathing. Take calm, deep breaths and relax. Slowly come out of position by pushing yourself up using your forearms. Exercise 3. Massaging the gluteal muscles. You will need the Blackroll Ball 12 again for this exercise. Place the fascia ball on the floor and sit on it with your right buttock. Place your right leg on your left thigh. Move slowly on the spot and take note of any specific tender points. To increase the pressure even more, you can hold your ankle with your left hand. Find a painful spot on this side and keep applying pressure to it for about 15 seconds. Take calm, deep breaths. If you have any problems supporting yourself with your shoulders, put more of your weight onto the ball to take weight off your shoulders. If this is too intense, use a fascia roller instead of the fascia ball first. Roll on it slowly in a circular motion. Put your right leg down and place the ball under your left buttock. Place your left leg on your right thigh. Move slowly on the spot and take note of any specific tender points. Move forward, backward, sideways, or in a circular motion. If you want to increase the pressure, hold your left ankle with your right hand. Find a painful spot on this side as well. Hold the pressure on this spot for 15 seconds. Don't forget to take a deep breath in and then exhale. Continue to roll. Just 5, 4, 3, 2, 1. Slowly come out of the position. Exercise 4. Triggering the lateral pelvis. You need the Blackroll TMX Trigger for the next exercise. Stand with your side to the wall and position the trigger tool on the painful spot in your lateral pelvis. Stay in this position and take deep breaths in and out until you feel the pain subside. Trigger the spot for a total of 3 minutes. As soon as the pain subsides, you can slowly move your leg back and forth. This is how you create additional mobilization. Treatment with the trigger may seem like it takes a while. However, in order for your body to feel the positive effects, you should linger on a painful point for at least 3 minutes. Try to relax as best you can. To do this, focus on the body parts you are treating with the trigger tool. Just a little longer until you switch sides. Just 30 more seconds. Place the trigger on the other side of your lateral pelvis. Find a painful spot and repeat the treatment on this side. Try to relax as you exhale. You can vary the amount of pressure yourself. Keep applying pressure here for 3 minutes. Once the pain subsides, you can start to slowly move your leg back and forth. Taking deep breaths in and out activates your diaphragm and your parasympathetic nervous system. Your body relaxes and tightness eases. Make sure you are practicing conscious abdominal breathing during the exercises. Treatment with the trigger tool promotes blood circulation. In order to be able to release tension in the tissue, oxygen-rich blood must reach the cells faster, and oxygen-depleted blood must be removed more easily. Treatment with the trigger tool helps your tissue to regenerate. Just 30 more seconds. And 5, 4, 3, 2, 1. And you're done. Exercise 5. Stretching the iliotibial IT band. You need a Blackroll superband in the resistance of your choice for the next exercise. Start in an upright position and put the superband around your right foot. Grasp the band with your hands. Slowly lie down on your back and place both legs on the floor. Actively raise your right leg with the superband as high as possible. Now let it sink inward. Use the band to pull your leg further into the stretch and remain in this position for 1 minute. Take deep breaths in and out and try to relax. If you can, go a little deeper into the stretch the next time you exhale. If you want, you can also do some small circular movements with your leg. bring your leg back to the middle, come back into an upright position and switch sides. Place the band around your left foot. Hold the band with your hands and lie down on your back. Raise your left leg as high as possible. Now let it sink inward. By pulling the super band, you can vary the intensity of the stretch. Stretching mobilizes the connective tissue, relieves the joints, and supplies the corresponding area with blood. All of your tissue will be smoother and more resistant. Feel free to start making small circular movements with your foot again. Good job! Bring your leg back to the middle and come back into an upright position. Exercise 6. Stretching the gluteal muscles. Next exercise. You will need the super band again. Make sure to attach it to an object. Start on all fours and place the super band around the inside of your right thigh. Place the band close to your hips. Bring one leg in front of your body and bend your knee to between 45 degrees and 90 degrees. Stretch your left leg out behind your body and press your pelvis toward the floor on the side of your extended leg. If you are unable to assume this position, place a black roll under your right thigh. This will make it easier for you to get into the position. To increase the stretch even more, put your forearms on the floor. If you want to go a little deeper into the stretch, lay your head on the back of your hand. Pulling the band in this position pulls your hip joint into the correct position. It also increases the effectiveness of the stretch. Switch sides in 5, 4, 3, 2, 1. Position the band around your left thigh. Bring one leg in front of your body and bend your knee to between 45 degrees and 90 degrees. Stretch your right leg out behind your body and press your pelvis toward the floor on the side of your extended leg. Put a black roll under you again if this makes it easier for you. Intensify the stretch even further by resting your forearms on the floor. If you can, lay your head on the back of your hand. Come back up to the starting position. It's now time for the strengthening exercises. Exercise 7. Activating the external hip rotators. Grab a black roll loop band. Pull the band over your legs and position it above your knees. Lie down on your right side and bend your hips to about 45 degrees. Raise your top thigh and rotate it outward. Then return to the starting position. Repeat this exercise 10 times. 5, 6, 7, 8, 9, 10. Slowly switch to the left side and do 10 repetitions here as well. Make sure that the inner edges of your feet remain on top of each other. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. So time to switch to the other side again. Come back to the starting position. The next set starts in 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch sides and do another 10 repetitions here as well. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take another quick break before starting the last set. Get ready, take a deep breath, and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Time to switch sides one last time. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're done. Just one more exercise to go. Exercise 8. Loop band bridge. You will need the loop band again for the last exercise. Place it just above your knee and lie down on your back. Rest your arms on the ground alongside your body. Tense your abdominal muscles and lift your pelvis toward the ceiling as high as you can. Briefly hold the position and lower your pelvis down again. Your buttocks should not touch the floor. Lift your pelvis back up and repeat the exercise a total of 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a short break. Can you feel your glutes yet? Get ready. We're going to start lifting and lowering the pelvis again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a quick break before starting the last set. Okay, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're done for today. If you perform these exercises 2 to 3 times a week, you can help reduce your pain. We hope you feel better soon. See you next time.